Welcome to a new episode of Medicine in 3 minutes. As usual, we go start to the point, the subjective bravely made clear and often illustrated. Let's start. Today's topic is about sleep apnea. In this presentation, we will talk about a reminder and sleep diagram, the definition, obstructive sleep apnea, central sleep apnea, mixed sleep apnea, sleep diagram, epidemiology, cause, physiopathology, symptom, polysomnography, treatment, CPAP, and medication. With snoring and sleep apnea, there is some risk of hypertension, 2 times, risk of cardiopathy, 3 times, risk of stroke, 4 times. 40% of obese are suffering from snoring or sleep apnea. 60% of sleep apnea are male and 40% are female. But at the age of 60, the female and male are equally affected by sleep apnea. There are 3 types of sleep apnea: obstructive sleep apnea, central sleep apnea, and mixed sleep apnea. We will start with obstructive sleep apnea. What is obstructive sleep apnea? He is a normal individual and he is a patient suffering from sleep apnea. Obstruction airway becomes flexible. Sleeping at night stranded this flexibility and collapse the airway. Here there is a collapse of airway. This diagram is to understand sleep apnea. The blue is about wake up. The red is about REM, rapid eye movement. And the yellow is about no rapid eye movement. The rapid eye movement is called the paradoxal sleep. And when we go from wake up to the sleep, there is some stage 1, stage 2, stage 3, and stage 4. This is the deep sleep, and here the sleep is light. And then we go from stage 4 to stage 3 to stage 2, and then we go to our REM. And REM, it's a light sleep. This paradoxal sleep or REM sleep occur more frequently in the second time of the night. And it's going longer and longer with the time. Sleep apnea occurs during this REM period. Let's deal with the physiopathology of sleep apnea. During REM sleep, decubitus dorsal make apnea worse. The diaphragm goes down, and lung develop negative pressure. That leads to decrease of oxygen saturation. And this the decrease of oxygen saturation sends stimulus by the sympathetic to the medulla, which alert the reticular substance to trigger the wake up. Less oxygen lead to wake up. When the person wake up, it starts breathing. And so on all during the night. This alternance between sleep and wake up is repeated 500 times at night, 10 to 15 times per hour at least. Consequently, in the long term, patients develop pulmonary hypertension and right heart failure. Airflow shunt down 10 to 15 times hour, oxygen saturation decrease, lung pressure increase, and leading to daytime sleepiness and hypertension core pulmonary. To make a diagnostic blood test, there is an increase in bicarbonate by respiratory acidosis. But the gold standard test is polysomnography, which is electroencephalogram, electrooculogram, and electromyogram. To treat the obstructive sleep apnea, we use a REM sleep supine. Supine condition worsen the apnea, and in order it is recommended to sleep in the side and weight loss. We treat obstructive sleep apnea by CPAP, pressure positive continue. It's not about pressure, it's about positive pressure. The second part is devoted to central apnea. Central sleep apnea is a central disorder of 5 to 6 stops per hour instead of 10 to 15 for obstructive. Here, there is no muscle retraction. Patient does not breathe fast enough. In this case, CPAP does not help much in this case. What we use? Diuretic acetosalamide or progesterone. They make the patient breathe in faster. This diagram is to show the difference between normal breathing and central sleep apnea. Here is hyperventilation and apnea. Hyperventilation and apnea. This is called Cheyne-Stokes rhythm. Sleep on the side and weight loss. Please support the channel by purchasing this ebook at KDP Amazon. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like and subscribe? And your comments are very welcome. Thank you.